Just ahead on Being Well, it's Ask the Pharmacist. Our guests this week are Renee Klingler and Nicole Rinker from Prairie Medical Pharmacy at Sarah Bush Lincoln. We'll be covering a wide range of common questions about prescription and over-the-counter medications, as well as vaccinations. Stay tuned. Being Well starts now. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston. Today's show is called Ask the Pharmacist, and I have two talented and educated ladies here to talk all about our pharmacy questions. First of all, talk about the kind of schooling and education that a pharmacist today needs to have.
Depends on which route you want to take. There's a couple different options. You could go directly into a 6-year or 7-year program, or you could complete a pre-pharmacy or a bachelor's degree and then go into a 4-year program to receive your doctorate.
So, and you guys both have your doctorate in pharmacology, is that what it is?
In pharmacy.
Yeah.
Pharmacology is one specific aspect what we study, but yeah, in pharmacy.
Okay, so what kinds of questions should people be asking you that we often don't? What kind of scope of knowledge do you have in the area of pharmacy?
We're able to tell patients how to take their medication, how to store their medication, side effects to watch out for, drug interactions that can occur with over-the-counter medications or with their other prescription medications.
Mm-hmm. And pharmacy has kind of changed. It's a faster paced, we live in a faster paced world, lots of drive-thrus, which is convenient, but are you seeing that that faster pace is taking away from some of that interaction that you have with people?
Definitely.
Yeah, I would say yes.
So what is the most common question that you often get on a daily basis from people?
How much their medication costs and if their insurance covers it or not. These are their most common.
Well, I mean, cost is important.
Yes, it is.
And you see generic and name brand. Can you explain what's the difference between name brand and generic other than cost, and why some drugs are not generic?
When a particular medication comes out brand new, the manufacturer has a patent on it. Mm-hmm. That patent's usually good from anywhere from 10 to possibly 20 years, depending on the medication and if they extend the patent. While the patent is there, the generic medication cannot be made. Only the brand medication is able to be distributed. So that's why those medications cost a lot more. They're trying to recoup all the money that they've made in research and paying their scientists and all their funding, advertising.
Yeah, it's expensive
Yes.
to create new drugs. All right, so we've all gotten probably a prescription that has those labels all on the bottle, things we shouldn't do. So we're going to go through some of them. First one is, why do some medications need to be taken at night?
Certain medications have been proven to be more effective in the evening. One of your most common ones is a cholesterol medication called a statin. And the reason you take that in the evening is it best helps the way our body produces our cholesterol, which is mostly in the evening and overnight.
So if you forget to take it at night, is there any danger in taking it in the morning or the afternoon?
No, not at all. It just may not be as effective as if you take it in the evening.
Okay, so let's switch to those medications that say take it in the morning, first thing.
An example of one of those would be like your thyroid medication. It's very stimulating, so that's why we recommend taking it in the morning. And then you also need to be sure to take that one on an empty stomach, otherwise certain foods or other medications can interfere with the absorption of that one.
All right, so you brought up foods. One of the things we often see is this interaction with dairy. It'll say don't take it with dairy products. Why is that?
The issue is the calcium in the dairy. which some people don't realize also can be in a multivitamin, fortified orange juice, anything containing calcium at all, an antacid.
Acids.
And it is because the calcium itself binds the drug molecules in your stomach, so your body doesn't get to absorb it as well. And it most commonly happens with antibiotics.
Okay. So what you had mentioned, full stomach, empty stomach. Why are some drugs better on an empty stomach, some on a full?
It all depends on how they're absorbed.
Okay.
So some medications require, not to go into a lot of chemistry, acid and bases. It depends on what crosses the membrane most easily. Whenever you eat, your stomach produces acid, so therefore some of those medications will be absorbed easier in a more acidic environment.
Okay. So, and then the last one we often see is don't take with alcohol. What class of drug? I mean, it's pretty obvious, but what kinds of drugs should you not take with alcohol?
Pain medications is a really big one. Any of our narcotic pain medications. Some medications that treat depression and anxiety, in particular the class called benzodiazepines. All of these cause a lot of sedation, and so taking them with alcohol can be very dangerous. Everybody's a little bit different. Some people are more sensitive to those effects, and therefore they would have more sedation and may develop complications from taking them together.
Okay, so read those label precautions and take them. It's an effectiveness thing and also a safety thing.
Yes.
All right, so let's switch gears. We'll probably get back to prescriptions, but over-the-counter medications, there are so many. Are there things we should be aware of in mixing over-the-counters with our prescriptions?
Yes. Certain pain medications contain Tylenol in them, so you never want to add additional Tylenol on top of that. There is a maximum recommended daily allowance of Tylenol because it can harm your liver, so that's really important. And it also can be found in combination cold products, which a lot of people don't think to read the back of the box to see that what they're taking already has Tylenol, and then they may take more on top of it.
Those combination products can be very dangerous because people start taking multiple cold medications, and if you don't read the labels, you may be taking more of something than you should be.
So is Tylenol's a name brand. Is acetaminophen, is that the generic name for acetaminophen? So if you're taking something, a prescription with acetaminophen, and don't be taking an over-the-counter with it.
Correct.
Okay. What about for people that, I've seen ads for this on TV, cold medicines and its effect on people with high blood pressure?
There is a particular line of blood pressure medications called Coricidin, HB. They make specific medications that don't have a decongestant in it.
Okay.
The decongestant is dangerous for people with high blood pressure because it can increase their blood pressure.
Okay. So you got to watch for that sort of stuff. Are there, just because something is over the counter, does it mean that we can just take as much as we want?
No. They all have limits.
Okay. So like which ones should we should probably be aware of all of them, but what are some we should really be concerned about for over the counter, watching how much we're taking?
Tylenol is a big one.
Okay.
Especially with so many different things that contain Tylenol in them.
What is the main issue that comes about when you take too much acetaminophen?
It causes liver toxicity.
Okay. So what is, I'll quiz you, do you know what is the recommended dose?
Maximum per day is 4 grams in adults, and sometimes greater than 65, they've actually started recommending 3 grams.
Okay.
I feel like it's a little safer.
So like we're not thinking about grams. How many pills is that a day? That's about.
It depends on the strength of Tylenol that you buy, because it comes as 325 milligrams, 500 milligrams, or 650 milligrams.
Okay.
So it'd be like 8 of the 500.
8 tablets a day. Can you mix like acetaminophen with some of the other, I can't think of the generic, but like Aleve and ibuprofen, which are no, I'm not the pharmacist. What's the other class of?
They're NSAIDs.
NSAIDs, which are the anti-inflammatories. Can you mix those and be okay?
You can alternate them,
Okay.
but it also depends. If you're taking some other medications, there's certain ones you can't take while you're on NSAIDs. In particular, blood thinners. NSAIDs thin your blood, so we worry about you having a bleed.
Okay, so you really need to tell your doctor, tell your pharmacist about the other things you're taking as well.
Yes. Communication is important.
And is that something you think people fail to think about?
Sometimes I think they think, oh, it's Tylenol, it's harmless, or it's Aleve, it's harmless.
Just because it's over the counter doesn't mean it's not important.
Okay. So what about vitamins and supplements?
Important as well. They're, like Nicole mentioned, the blood thinners, they can interact with a lot of our herbal supplements. So making sure your doctor is aware of everything that you're taking.
Okay. Let's talk about, when it's cold and flu season, you go into the pharmacy and you get all these, there's lots of choices.
Yes.
I always have a hard time picking. I don't know what to choose. I mean, should I just get something that covers everything, or what do you do?
We were just talking about this the other day. As pharmacists, we actually both do the same thing. We treat our symptoms. I buy individual products and I pick and choose what I need to take based on our symptoms. But I also understand people that are already taking a lot of medications, you don't want to take a lot more. So the combination products may be better suited for them. But it would be important to go ask the pharmacist, go get them, have them help you pick something out that would be most appropriate for you.
Okay, so you shouldn't, if you don't have a cough, don't get something that treats cough. Is that what you're?
You don't really need it, so just be taking extra medication.
Okay, let's talk about treating colds. They kind of hang on for a while. I mean, if you give us some advice, so someone's starting to feel those cold symptoms, when should they start taking something?
Right away.
Right away. And then what's the typical duration of a cold?
It can last up to like 3 weeks.
Okay.
Depending on the virus.
Yes.
So what about for flu? Is there anything out there that we can take for the flu?
If you have a true respiratory flu, there are some prescription medications available if you go see your doctor, depending on your specific situation. Over the counter, you're really just going to treat your symptoms.
Okay. Now I want to talk to you guys about, and we see it in the news, a lot about this antibiotic business. And we've had several people on the show talking about antibiotics. This is your platform to talk about antibiotics and, kind of some of the dangers that can come if we're taking them when we're really not supposed to.
Antibiotics do not treat viruses. They only treat bacteria.
Okay.
So having an antibiotic prescribed to you or kind of requesting one when you don't need it doesn't do you any good. The only thing it does is bacteria are kind of smart and they figure out how to become resistant. They figure out how to beat the antibiotics or get around them. So the more we take antibiotics we don't need, we're creating bacteria that is smarter than the antibiotics that we have, kind of.
So what kind of illnesses are bacterial versus viral? Because I always get that mixed up.
It depends.
Okay.
Pneumonia, typically bacterial. Ear infections, typically bacterial. Sinusitis, typically bacterial. But viruses can cause some of them.
Okay.
So it's important to see your physician. They can help with the diagnosing of whether they think it's bacterial or viral, depending on your symptoms.
So the flu and the cold are generally viral.
Yes.
And you just got to sort of deal with the symptoms. Let's stay on antibiotics. What are some things that can cause some interactions with antibiotics and some issues when you're taking one thing and it lessens the effectiveness of maybe something else?
The biggest thing is birth control.
Okay.
We already talked about how food can affect the effectiveness of the antibiotic, but the antibiotic can make birth control not as effective.
Okay, I get an antibiotic for a bacterial infection and I start to feel better and I decide, I'm done. I kind of, sometimes antibiotics make you feel kind of itchy anyway. What's your recommendation for antibiotic taking it?
You need to finish the full course of therapy.
And why is that?
By stopping early, you're probably not killing all the bacteria we were trying to treat, and therefore, like Nicole said, they're going to become smart. They're going to become more resistant to those medications, and it's going to make it harder down the road for the doctors to treat infections that you're getting.
Okay. So take all of it, even if you're feeling better. Is that sometimes what happens to people? They don't take it, and then they get it again, and then they need something stronger? Is that sort of starting that cycle?
Yep, that can definitely start it.
Okay, so be careful about the antibiotics. Why do they make me kind of nauseous? Why do antibiotics seem to create that nausea feeling for some people?
It's just certain classes and the way the structure is, and it can be very hard on the stomach.
Okay.
Yeah.
Anything you can do to lessen the effect?
Some of them specifically can't really distinguish between good bacteria and bad bacteria. So it kills the good bacteria that's found normally in our stomach and our intestines. So one of the recommendations is to take like a probiotic yogurt that can reintroduce the good bacteria into your stomach. It helps with the classes that cause, the diarrhea and things like that.
So are there some side effects from taking antibiotics because it's getting rid of all the good bacteria too?
Diarrhea is a big one.
Okay.
Some women experience yeast infections when they take them.
Okay, but they're necessary sometimes. All right, so another area that you guys deal with is vaccines.
Yes.
Let's talk about this 2014-2015 flu vaccine. Let's talk about how the vaccine, is developed early in the season, how that whole process works.
Basically, they look at what strands of the flu were most prominent the flu season before. So it would have been the 2013-2014 flu season. Based on the most prominent ones, that's how they determine which ones to put in the vaccine. So it's a guess. I mean, it's not going to always be 100% match.
So now we're hearing, or we've heard that maybe this flu vaccine is maybe not. They didn't quite guess just right. What's going on?
It's different, just different strains of the virus seem to be occurring. So people that did get the vaccine may not have coverage against that specific strain. So therefore they're getting sick.
So are they going to come out with is there another vaccine to treat the flu that's out there that's more prevalent, or are we just going to have to hope for the best?
We'll just have to hope for the best, and prevention is the main thing. Still getting the flu shot, you could be one of those people that gets one of the strains that the flu shot does cover. You just never know. So getting the flu shot is good. Hand washing, those are really the most preventative methods.
Okay, so what do you say to people who say, when I got a flu shot, I got the flu right away. I felt terrible. What's going on? Are they really getting the flu?
No.
What's
Go ahead.
So when we get the flu vaccine, it introduces inactivated parts of that virus into our body that lets our immune system produce a memory of how to fight it. So when your immune system kind of gets ramped up, you feel certain things. You might feel like you have a mild fever. You might have aches, things like that.
Feel tired.
Yes. Those are all symptoms of your immune system being activated, not necessarily the illness, but people associate it with the illness because the same thing happens when you get sick.
And some people's bodies just need to create more of a response than others, and so some people have a hard time after getting the flu vaccine.
Okay, let's talk about I'm kind of on this flu thing right now. People, how do you distinguish between whether you get a cold or a flu? Is there something telltale that says this is really the flu, this is not just a cold?
I want to say fever is one of the big ones. You start developing a fever.
And kind of the all over body aches, just feeling like you're just completely kind of got hit by a truck or just hurt all over.
Yeah, it's a cold can be really bad. I think the worst part about cold is it just drags on for like 2 weeks. It just takes forever to get over. So fever is kind of the biggest indicator of the flu. All right, so let's talk a little bit about other vaccines that people can get at their pharmacy. What are some other common ones that you guys do?
Pneumonia is a big one. Shingles vaccine, meningitis, hepatitis, tetanus and diphtheria. That would be like your whooping cough vaccine.
Those are pretty much
Those
the
are the main
ones.
ones. Yeah, I was going to say if I'm missing any.
Who do you recommend gets a pneumonia vaccine? Is that an annual thing that people should be getting? No? Typically,
it depends if you have any of the disease states that put you at more risk for pneumonia.
Okay.
So a big one would be if you have COPD. You typically can get your vaccine earlier on, and then the CDC doesn't recommend getting revaccinated until after you turn 65.
Okay.
So possibly 2 in your lifetime.
Okay. What about the shingles vaccine? Because I had shingles at 40, and I would love to get that shot because I don't ever want to I didn't have a bad case of it, but I don't want it again. Can I get it, the vaccine?
It's actually only indicated for patients who are 50 years or older.
Okay.
If you are 65 and older, you can go to your pharmacy without a prescription. If you are 50 to 64, you have to get a prescription from your doctor.
Okay, so why can't, I mean, I'm 44, I'll be 45, why can't I get it now? Why do I have to wait till I'm 50?
It's not indicated for that age range. Typically, those are the healthy people. You don't develop, it's not as common for people to get shingles in that age range. So we're more concerned with the people who are older, have a more weakened immune system.
Okay, so if you get that vaccine, are you guaranteed that you will never get shingles? No.
Especially with the shingles, there's different reports on how effective it is, but it's not as effective as, say, the pneumonia vaccine. But what you can, hold on to is that if you do get it, it should be a shorter duration with a less severe case.
Okay.
So even though you may get it, it shouldn't be as bad.
Yeah, I mean, we're starting to see lots of ads on TV for shingles. You just never even really heard of it before, and now it's become so mainstream. I mean, if you've had it, it's not a fun thing to have. It can be very dangerous. All right, so talk about some other advice that you think people need to know. Maybe here's a question. What should people have in their medicine cabinet? Not that we really have, some people have the traditional medicine cabinet, but what do you recommend as pharmacists?
We were talking about this yesterday also, and we both said Benadryl at the same time.
Really?
Benadryl.
Allergic reactions can happen anytime. You may develop an allergy that you don't know about. So Benadryl is the quickest and best thing to treat it, especially if you're needing to tide yourself over till you can get to an ER.
Okay, so Benadryl, what else?
Pain medication. I mean, everybody's different on what they think works best for them or what they should be on based on their other medications. So whatever preference of pain medication that you want. We were also talking about where you keep your med cabinet. That's very important. A lot of people keep their medications in the bathroom. That is not a good place to keep your medications.
Okay.
Moisture can degrade those medications. So whenever you're taking a shower, taking a bath, all that moisture gets into the air. It can be very harmful for your medications. Okay. So best place to keep them in is a dry cabinet.
All right, so this always happens to me with cold medications. I get some, don't take it all, and then I get a cold 2 years later, and I look at that expiration date. I'm like, well, it's still good. How often do you recommend cleaning out that medicine cabinet?
If it's expired, I would not recommend taking it. Okay,
am I going to die if I take expired, cold pills? Or what happens to that, any kind of medication after it's expired?
Most medication just becomes less effective.
Okay.
Some medication can be dangerous if you take it after it's been expired. Tetracycline is one of those medications. Okay. So if you have that and it's expired, get rid of it.
Yes.
Okay. What happens to it? Or what, does it just change its chemical composition?
It does, yeah. It's very harmful to your body if you consume it after it's been degraded.
Which I should ask this, what if, your child gets sick and you don't have like a children's strength of like Tylenol or something? Can you give them a smaller dose of an adult size? Or what about for children taking adult medications over the counters?
You technically could. It's the same medication. The biggest thing with the difference between the children and an adult is the concentration of each. Okay. So you would have to be very, very careful, and I would say consult a doctor or consult someone with exactly how much you should give, because it will be a much smaller amount.
And so it may be harder. Those are usually pill forms, and some of our kids don't take well to pill forms. The liquid is a lot easier for them.
Yeah, and it's kind of hard to cut pills in half and making it exactly in half.
Exactly.
What do you recommend if people do see this and are like, oh, I should clean out my medicine cabinet? What's the safest way to get rid of meds?
We actually take them back at the Prairie Medical Pharmacy at Sarah Bush. We do take expired meds back. They recommend diluting them in water and pouring them over kitty litter and coffee grounds. That helps absorb it, and you can just throw it out. Do you have any?
They also usually do yearly take-back events through the police department, especially if you're controlled substances. That's a good way to get rid of a lot of those. So maybe doing like a yearly med clean out in your cabinet, maybe close to one of those events, and just take all your meds there and you can get rid of them.
Okay, but most pharmacies will take Do you guys only, or
A lot of
a
pharmacists
lot of them
don't.
don't? Okay. I did, you know, we've seen reports where it's not good to put them down the garbage disposal or the toilet because it infiltrates the water supply.
That's why it's nice to put it, if you put it in the kitty litter or something like that
Okay.
first, it helps absorb that out of it.
And it makes it less appealing for anything to get into it.
That's true. I mean, some pills look like candy
Yes,
for
they do.
pets and children, and you know, we need to just be aware of, you know, also, you know, other people invading the medicine cabinet as prescription drug abuse has become a problem.
Yes.
So we just got like a minute left. Any last little bit of advice you want to give to people on medications or maybe pharmacists?
Feel free to ask us questions. We're available anytime. You can always call your pharmacy, or don't be afraid to stop a pharmacist and ask them, even if they seem busy.
Always having an up-to-date med list with you.
Yes.
Yeah.
That is very important. If you go to the hospital, it's good to be able to show them what you're on, over the counter and prescription. And going to your pharmacy, if you're asking about that cough and cold medication, if you can pull out your list and say, this is what I take, what is not going to interfere with this.
All right. Did you have something else?
Well, back on the vaccines, a lot of people don't realize with the tetanus one, you are supposed to get boosters. So then whenever they have an accident or a cut or a fall and they come to the ER, they're not up to date, so then they have to get the shot. And the pertussis or whooping cough also helps protect the elderly and especially little babies.
All right.
So that's a good one to stay up to date on too.
Well, thank you, ladies, for stopping by our show and giving us great information. So
Yeah.
this
Thank
was
you for
Ask
having
the
us.
Pharmacist. So they encourage you to ask your pharmacist if you've got questions. Thanks for watching.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston.